Welcome to the Board of Health hearing on July the 22nd. I would like to ask Melissa to do the roll call for the quorum purpose.
Tom Lee,
Present?
Dr. Guadagnoli, Dr. Caniff,
Present.
Dr. Beer, Dr. Waller, and Dr. Lusko is absent presently. We will add them to the minutes when they come in.
Yeah. And your staff?
And staff, Tom McKean,
Here.
and myself, Vanessa Tripp.
Thank you.
Thank you.
This meeting is being recorded and broadcasted on the Town of Barnstable's Government Access Channel. In accordance with the Mayor General Law, Chapter 38, Section 20, please let the chair know if anyone is recording this recording or transmission this hearing. Seeing none. With the two other members not here right now, I'm going to take things out of order and start from the septic installer first. The first one is Bill Smith, septic installer, representing Bay State Sewage Disposal, Inc., 105 Kingman Street, Lakeville, Mass., requesting approval to become a licensed septic installer in the town of Barnstable. Good afternoon.
Good afternoon.
You Bill? Can you speak to the mic? Is it on? Is the green light on?
Yes, I believe so.
Push the button.
Oh, there we go.
There you go.
Sorry about that.
That's okay. Can you say your name again?
Bill Smith.
Bill Smith.
Yep.
Staff.
Bill Smith passed the local exam. All three references were contacted and all provided good references. We have no objections.
Thank you, staff. Any question from the board?
No.
No. Motion to approve?
Second.
All in favor?
Aye.
Thank you. Good luck.
Thank you.
The second one is William McClare's septic installer, 35 First Parish Road, Norwell, Mass., requesting approval to become a licensed septic installer in the town of Barnstable. Good afternoon.
Good afternoon. I'm
must be
William
Bill.
McLaren. Bill
Right.
McLaren.
Okay. Staff?
Mr. McLaren took the local exam. He missed it by a couple of questions. One reference was provided and provided good information. We've been trying to get in touch with him to obtain the other two references' phone numbers, but he's been not available medically. So we can follow up, but we have no objections to granting this, and with that condition that we contact the other references that he provides.
Just so the approval pending on the further
Yes.
reference check. Right.
I've had my license twice in the past in the town of Barnstable, and just wanted to renew it this time in hopes that I could help myself as well as a couple of sisters and a brother in the future. So that's pretty much the story behind it. As you get a little older, you get a little tougher to remember things.
We all do this. Sometime we reach that stage of life.
You haven't reached my level yet.
Yeah. Thank you. Any question from the board member?
No.
Motion to approve pending references?
Anyone second?
Second.
All in favor?
Aye.
Thank you.
Good luck. Thank you.
Right on. Thank you very much. Thank you, Tom.
Yeah, thank you. Dr. Leskop is here.
Dr. Lusko? Thank you.
The third one is Warren Miranda, West Harwich, Mass., requesting approval to become a licensed septic installer in the town of Barnstable.
Mr. Miranda, I don't see him here in the audience, but two references responded, and they were both good. He took the local exam. He missed it by a couple of questions as well, but we have no objections for granting it.
Can I just ask a question?
Yeah.
Is missing it by a couple of questions passing?
No,
How many questions are there?
I don't have one with me, but you can only get 12 wrong, and if they get 14 wrong, it's less than a 70%. We're trying to achieve a 70% to pass on this exam.
Right.
And does your recommendation for approval kind of depend on which ones were missed? or-
No. The board has granted in the past, others in the past last year that were off by a couple questions, so we're just,
Okay.
and this particular applicant wants to finish the 7 Aaron Road Hyannis project. That's been before the board several times.
Remember that?
He wants to complete the permit for the septic tank that was relocated.
That was a project a couple months ago. It went on for a couple months and trying to get it done and trying to get it licensed, permitted.
Oh, okay.
Yeah. At that time, he did not have the license to get the permit, so.
So you have no objections to
Yeah, no objections.
move to approve?
Second. All in favor?
Aye.
Tom, do you want to wait or can I go back to the top?
You go to the top now, correct?
Yeah.
Yes, start at the top, yes.
Okay. We'll go back to the first item, is the annual election of the officer. Every year, we do these elections in July, which is a new terms for us. So,
Sure. Okay.
I'd like to move Tom as chair and Dan as vice chair.
Second.
all in favor?
Aye.
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 So we are set. The second item is Mass Department of Public Health State Actions for Excellence, Public Health Excellence Shared Services Grant Program. Director Tom McKeon seeks approval from the Board of Health to accept, support, and promote agreements between the towns of Barnstable's health divisions and Barnstable County to participate in Mass Public Health Excellence Shared Service Grant Program. This program promotes and supports interior municipal shared services agreement and cross-jurisdictional sharing with contributes to improvement to local public health capacity. Currently, there are 12 municipal health departments within the Barnstable County that participate in this program. No? Or
Yes, I'm seeking the Board of Health support to accept this program for the town of Barnstable to join in on the grant. They have a little slide presentation that they would like to provide. Jay Gardner, the county health officer. The reason I'm asking for this, I believe it'll be very beneficial to the townspeople in that it supplements what we provide, things that we cannot provide. For example, nursing services. We have a part-time nurse. There's only so much she can do. They have multiple nurses. They can provide clinics, bone density, skin cancer screening, cholesterol screening types of clinics. They do a lot of public outreach, health promotion. I'd like to turn over to Jay Gardner and his staff to do a presentation. Thank you.
Thank you. Good afternoon, Jay. Welcome. Make sure your mic is on.
Can you hear me?
Yep.
Mr. Chairman, thank you so much, board members. Appreciate the opportunity. Jay Gardner, I'm the Director of Health and Environment for Barnstable County. I'm joined by Dr. Katie O'Neill, and she's the Program Director for what we're going to present to you today.
Okay.
Before we get started, I'd like to just hand out a little bit of information so you have some things in front of you, if you don't mind. Thanks, Jay.
Thank you.
As Katie is passing those things out, just a little bit of background, I will tell you, Majority of my career was up in central Massachusetts, Director of Public Health in Worcester, Commissioner of Health and Human Services, and a number of different national nonprofits in healthcare. But the most significant piece, and most relates to what I do at Barnstable County as their Director of Health and Environment, is I spent 2 years in Yarmouth as their Director of Health. So I do understand what the municipality, the challenges that Tom faces, and each of the 15 communities across the Cape, the difficulty. Public health, I've had a long time, it's vastly misunderstood, and as a result, widely underfunded, right, and underappreciated. What this program does, and we'll run through, I do see you have a lengthy agenda. I want you to understand the capacity building that this opportunity presents, right? In Yarmouth for a long time, when I first got there, my predecessor didn't feel it added value. We were going to actually, he felt Yarmouth was going to have to send capacity personnel to other communities, and that's just not the case. That's just misinformation. Once you have a strong understanding, we're here to add value to your program. Tom mentioned it might be in nursing. We have community health educators. We have an outreach opportunity to strengthen and help. And you decide as board members the policy, Tom as the operational person, to say, what is it that you need? And we will put that together, whether in professional training, things of that nature. We're here to work with you to be a collaborative partner in that way. So I'll talk to Katie O'Neill, can kind of run you through and talk to you a little bit, and hopefully you have some questions, and this will gain a better understanding, and we're seeking your approval to come join us, to join the other 15 communities.
Great, thank you so much. Can you hear me all right?
Make sure your green light is on.
How about now? Just not close enough. Great. Again, for the record, I'm Katie O'Neill. I'm the Shared Services Program Manager with Barnstable County. We really appreciate your time this afternoon. I myself am a lifelong Barnstable resident. I live in Cotuit now with my family. So I'm really excited personally as a resident to have the opportunity for Barnstable to take part in this. Let's get going. So all the members within the group have come up with a mission, and basically they are calling themselves the Cape Public Health Collaborative. I won't go too much into it. I know you have a really busy agenda, so I'm going to go through this presentation quickly. The Public Health Excellence Grant is a state-funded program that was based off of a special commission report that was done in 2016. And this was done pre-COVID. The special commission came out with a blueprint of public health report in 2019, right before COVID hit. And unfortunately, when the pandemic hit, it really solidified all of the data in that report that the 351 individual towns really didn't have the staffing, funding, or training to handle a pandemic of that size. And so what they did is come up with recommendations, and part of that recommendation was to actually put the money where their mouth is, and they provided a grant opportunity for the municipalities to take part to expand their services and increase the efficiencies of public health. A lot of the benefits that come along with it are close to $500,000. It's not split evenly within the towns. It's a single pot that the governance board, the 12 towns vote on. So it's completely designated by the governance board. One town doesn't have the bulk. It's not based on population. It's completely voted on by the governance board, which is comprised up of the health directors from those 12 towns. We also have received more than $500,000 for a training hub, and local legislation has changed within the past year or two that will require all health departments to retrain their staff and make sure that they meet minimum standards of training credentialing. So depending on your staff position would have different criteria for training and credentialing. We can get into that more later if there's any questions, but there's significant funding in order to actually meet that requirement. As I mentioned, the governance board is comprised of the health directors from each of the towns. And there's no financial obligation to the towns whatsoever. If you're not happy with the program, you can withdraw. You don't owe any money back. It's really quite a fantastic program. You can opt out at any time. There's no penalty. There is an agreement, so there are criteria you as the Board of Health have to vote, as well as the town council both have to vote to withdraw. But that's really the only criteria that you have to do if you're not happy with the grant program. So what we've done up to this point with the funding, you may recognize Donna Morandi. She's one of our contract health inspectors. She was with Barnstable for quite a long time. She's fantastic. We're really happy to have her. But she's our on-call health inspector. So if the towns have someone that's out on an illness or a training or vacation, they put in a request and Donna comes and covers for them. So she does any foodborne illness investigations. She does routine inspections. She does fairs, festivals, parades, you name it. If a town needs help, they put in the request and she comes out and helps them out. We have a food truck inspection program. So it's a single annual inspection for food trucks. It's been great for the vendors. They get a sticker, they get an inspection at the beginning of the year, and it's really been a streamlined process having a consistent inspection for the initial annual inspection. They still get inspected throughout the year, but in order to get their initial permit, it makes it a lot easier for everyone as well as consistent across the board. I passed out some tick removing kits. Right now we have community health educators that are out in the field, literally at trailheads, beaches, anywhere with a high tick population. They're educating people on how to prevent tick-borne exposures and how to actually remove the ticks. And we give these kits away to residents that are out in the field, which has been a really great opportunity. We have purchased refrigerators for 2 or 3 towns, and basically restaurants can donate, any local farms. It's just a community fridge. If you're in need, there's no questions asked. It's monitored by the town, but it's free food for anyone who's having food insecurity issues. We have really done quite a few clinics, as we mentioned earlier. So whether it's a vaccine clinic, a skin scan clinic, bone density clinic, we have a wide variety of nursing services that we can offer, which has been a really great opportunity for all the residents as well as the towns. We do very regular blood pressure and glucose screenings, and we have summer sanitarians as well. So those services are also expanded. The county already offers that as just part of our general package, but this grant has been able to increase those hours and what they're doing out in the field. So this is just kind of a picture of us at the farmers market. So we're really out in the community working with the members, doing a lot of public outreach and education. We're working on a youth vaping prevention program right now. So there'll be a needs assessment done with the schools to see what they're already doing and help identify any issues that they're having or specific areas that they'd like to have worked out on. We have a wonderful epidemiologist. She's amazing. We have a fantastic foodborne illness surveillance program. We're working on expanding some of that confidence around vaccines and getting ahead of some of the misinformation. We have a really fantastic social media presence that we share with the towns. It doesn't necessarily have to be branded in any way, so you can kind of make it your own. And we're also working on a Cape Cod climate health and kind of plastics-free campaign. So that's something that will be coming out at the end of the summer and the beginning of the fall. We also will be funding future trainings. There's quite a very expensive training, especially MHOA. A lot of the towns can't afford to pay for it, or they can't afford to pay for the hotel for their staff. So this grant is a great opportunity to cover those costs that the town can't currently cover. And this is just kind of a brief snapshot of the performance standards. This is what the grant was based on. So in order to take part in the grant program, there's a capacity assessment that gets filled out. And the average for Massachusetts across the board was 78%. Cape Cod were 87%. So we really are already meeting the performance standards. So we're at a great opportunity where our inspections are being met, so we can expand the community health education outreach and that side of public health, which has really been lacking for a lot of towns just because they're in the grind doing the inspections day to day. They haven't had time to get out in the community, do the outreach, education. So it's great to see that the Cape is already ahead of a lot of the other communities in the state. If you would like to participate, which we hope you will, the first step is to sign a letter of commitment. So that would both be you and either the town council or the town manager as representing them. The capacity assessment data, which we're happy to send a staff member in to help with, and that's really based on the number of inspections that are done, violations written. It's very I wouldn't say time-consuming. You were the last to do it.
The county came into Yarmouth when I was there, and they guided us through the process. They want to see where is it, and that's a snapshot of what do you have for staff, what FTEs, what staffing do you have, and what's the challenges that are in front of you. They want to get a sense of what's making the phone ring, how many housing inspections, what are the complaint basis, things of that nature, and then that gives them a baseline of where we want to go from there.
And the only point in that is to see if they need to increase our funding. So it's not to come down on the towns and say, oh, you're not doing this, you're not doing enough inspections. It's just to see if we'll need more money as a group. That's the only reason that they do that. And then you would sign an intermunicipal agreement, which the other communities have already signed. And then, oh, perfect. And really, the only criteria to take part in this is a staff member has to attend a monthly meeting. It doesn't always have to be the same staff member. It can be a Board of Health member. We just have to have one person that attends the meetings and can vote on items.
It can be virtual.
And it's virtual. Yeah, we have a hybrid option. And eventually, the towns will need to meet performance standards, but that's a long way down the road. And towns are going to have to meet the performance standards regardless if you take part in the program or not. Any questions? I know I went through that very quickly and threw a lot of information at you.
No, when Tom initially mentioned about this program, and my understanding would be a lot more benefit to the town of Barnstable than anything else, because now he can rely on more resources from the Barnstable County for the nursing, for the bone density testing, and that sort of
Clinics.
stuff. So this is a good program for us to join, I think. Any question from the board member?
We were the last town. Every other town has signed already.
There's two others other than you.
2 others on the Cape.
Correct.
2 others. There's 12 out of the 15 right now who 12 out of 15 are participating, have been for a long time. And the other, I give Tom a lot of credit. He came to the office of county and said, I want to explore this. What would this mean? This isn't taking any authority away from the board. You still have all the control and policies. What if I just want to take care of certain things? Tom said, what if it's just the nursing and backing up on nursing? So this is a menu of services. You decide what piece. You know, what is the catalog? We have a long catalog of programs and services, and you may want to participate in many or if not all of them. But you decide what fits best. It's not a one-size-fits-all. You decide. If the nurse goes on vacation for a bit or for whatever reason isn't able to, we fill in and we do that. But I'd like to think far beyond what, and maybe incrementally you look and see what some of those, the community health educator, tremendous. We're getting a significant feedback and benefit from other communities. And one of the things, and Katie mentioned it quickly, but our epidemiologist, a contractor, if you go onto the Barnstable website, whether it worked through the hepatitis A case that happened out on the Cape recently, to the measles case, the measles outbreak that is still, percolating, still very much in the news, we have information that you can put up on your website so that your residents will be aware. And it's not, again, it doesn't have to be branded by the county. That information is all available to you, and I hope you would see the wisdom in taking advantage of that.
Especially from the epidemiology side, having the shared services has been really incredible because we have a much bigger snapshot of what's happening on Cape Cod, especially around infectious diseases, and especially the foodborne illnesses, because then we can really focus on specific areas of education and outreach with our community health educator, which has been really helpful for everyone.
I also appreciate the tick education. There never can be enough to prevent Lyme disease. This year is probably the worst I've seen in all the years I've been here as far as Lyme disease and tick populations.
Sure.
And our epidemiologist specializes in alpha-gal, which is a new up-and-coming, which we hope to not see here, but if we follow the vineyard, we likely will be seeing it within the next few years.
Any other question from the board member? Dan? Adon?
Yeah, so I guess functionally, initiatives would come from Tom, from your department, and you would kind of run it by the board to see if we were in agreement with, that's where we would want money to be spent?
Mm-hmm.
Yes, I would be attending monthly meetings, and I can provide updates to this board from those meetings.
That's right.
But
And we, again, would have the leeway to decide where we want to invest the money. So, because there were quite a few items listed. as we went through that. Not all of which maybe, look like, depending on your point of view, maybe not all of those look like things we would want to work on, necessarily. But you're saying that it's like shopping in the grocery store. Pick what you want.
A la carte. And
Yeah.
understand, when you talk about investing, and dollars are important, this is the grant dollars that Tom would sit on the board of directors and where we're going to direct those grant dollars.
Yeah.
So he has a vote on, he would have, if approved, and I don't want to, presuppose here, but if you were to move forward, those grant dollars, he would have a vote on that, and obviously bringing that back to the board to say, what are the things, what's a menu of services that we would like to participate in, but no expenditure to this community whatsoever.
And if the board does vote on something, so if you don't want a blood pressure clinic, for example, the other towns can still take part, but it doesn't mean you have to.
Yeah. Yeah, my only concern is that we've seen some public health initiatives, I think particularly during the COVID years, that now in retrospect, even at the time, but even now in retrospect, are appearing quite controversial, and those were forced on the public. And so I just want to make sure we're not getting into anything like that.
We completely agree. I was also the
this
health
is-
director during COVID, so I totally understand and agree with that.
Okay.
Yeah, I'll share that.
Part of this
Okay.
is to help rebrand public health and to help rebuild the trust around public health.
Well, we're experiencing that in medicine as well, so
Right.
there's a great loss of trust. Okay, thank you.
I'm curious as to whether you've worked or are working with an organization called Sharing Kindness. Are you familiar with them at all? They work on helping to prevent teen suicide in the high schools.
I am not. I know some of our staff members are. I can do a little more research, but we work with a lot of community partners. So I myself am not, but I believe one of my staff members are. So I'll find out and get back to you on that.
It's a very good and substantial program that's actually beginning to make a lot of progress in a lot of the schools, and might be something that
That's
you'd
great.
be,
I appreciate you sharing that with us. I'm not familiar with it, but we will be. We'll get,
I can give you some contact information.
That would be great.
Too,
I'm going to give you my card before I leave.
okay.
I imagine that involves a lot of social media.
Actually, it's and I don't want to derail,
Yeah.
but it is a program that was put together by one of our PCPs at Cape Cod Healthcare. I'm not sure she's still a PCP for Cape Cod Healthcare, but whose child committed suicide at 16. And she's come up with some very innovative ways, working with the school systems to help identify people, to get the kids to talk to somebody who they would talk to, as opposed to an adult, so that things can be funneled to adults to help. And she's been gaining more and more traction and more ground as this has moved forward, and it seems like, especially if you're a Cape-wide organization, kind of an ideal connection for you to make. So,
Through the chair to the doctor, that's exactly how this program would work, in that we're trying to move the margins, right? We're trying to move the margins on public health. So you would bring that suggestion you have to us now, and we can look at that through Tom to say, listen, might we, when you go to the excellence grants next meeting, would you talk about this? This is what we need in our community. So, but this suggestion right here, wonderful, and that's exactly where we want to strengthen and, like I say, move our capacity in a significant way. And I agree with you as far as our connection with public health at the state level. There's a lot of repair.
I think this is a long time coming, and I think this would be great for the town. I mean, it's everything the gentleman here have said is a help.
Thank you. We feel it will strengthen, but I do want to congratulate you with Tom as your representative. He came with very thoughtful questions to make sure what exactly, there's a lot of misinformation around this, and understand those shared services. My predecessor in Yarmouth thought, well, maybe we're going to be sending inspectors up to pick a town, Truro. That's not the case at all. That's not that. We're here to strengthen each of the communities in what they need, in what they see, what the Board of Health, what the administrator, what the town administrator sees as their focus and set of priorities. And they're not the same across the Cape. There are different sets of priorities. We're here to help and strengthen those.
Yeah, I think that'd be a tremendous help.
sorry. So is there an Katie, you mentioned the emerging trend on Martha's Vineyard that could be affecting the Cape. I assume that on the 12 town board, I guess, right now, are they tracking outcomes, and are they also, is there some sort of coordinated effort to find data sources for evidence-based decisions about matching capacity to some of the solutions that are offered?
Oh, yeah, that's a great question. So we're absolutely tracking outcomes for reportable diseases. So we're required to be part of the MAVEN system, which is the Massachusetts Epidemiological Network. Alpha-Gal is one of the tough ones to track the outcomes because there is no requirement for follow-up, and even the diagnostic criteria is really gray at this point. So for those diseases that are reportable and have solid diagnostic criteria, yes, we absolutely follow those outcomes. It's actually a requirement of the grant that we make sure those are done. But the unreportables are one that are tough. We would absolutely try to, but we don't have as many staff members to do that. And if it's not a requirement, we do our best, but it doesn't always happen. Does that answer your question? In terms of evidence-based decisions, something like the hepatitis C protocol, if we saw a surge in those cases, that would absolutely be something that we would, increase education around. But in terms of the tick-borne, I guess I'm not sure how to answer your...
No, that's fine.
Okay.
Those are some examples. Yeah, I was just wondering if there's an interest in an investment from the members. And also for health promotion.
So absolutely.
Data and measuring.
And so for the fiscal year just started this July, they actually increased the epidemiology services too. So the governance board has asked to increase those epidemiology hours. So that's absolutely something that if the town wanted to see, we'd have the capacity to do at this point.
Thank you.
Thank you. Could I have a motions to support this
So moved.
joining the Barnstable County program? All in favor? Aye.
Thank you all so much.
Thank you.
Welcome
Thank you
aboard.
for coming.
Thank you, Tom, for this. Thank you, to each of you. Appreciate it.
So do we just sign the form here?
Chairman will sign the agreement today, but Jay will ask the Director of Inspection Services to contact the town manager to get his signature as well. So we would have both, okay?
Those are two phone numbers that I have.
So I just sign the top
Go to
page?
sharingkindness.org. If my numbers are wrong, which they may be, because they may be old, but you'll be able to get a hold of her.
Do you want this back, or do you want me to just leave it up there?
Thank you for coming.
Thank you again. Pleasure. Welcome aboard.
One thing before I forget to the public, a few days ago, even last week, I think I heard the Barnstable County is offering a private well testing for free. So in case any homeowner want to test their private wells, talk to the Barnstable County lab.
It's on our website,
Yeah.
the application process. Thank you for mentioning that.
Yeah.
Appreciate that advertisement.
Yeah, thank you. We're going into the septic system variance. The first one is Dan Ojala, Down Cape Engineering, Inc., representing owner Frederick Jones, 4312 Main Street, Route 6A, Barnstable, map parcel 351-031. Variances requesting from section 360-1 of the Town of Barnstable Code, requesting reductions in the setback distance from the soil absorption systems to the BVW, 100 feet to 80 feet, and reductions in setback distance from the septic tanks to the BVW, 100 feet to 54.6 feet. Dan?
Good evening or afternoon, Chairman Lee, members of the Health Department or Health Commission. Dan Ojala, I'm a land surveyor and civil engineer with Down Cape Engineering in Yarmouthport, and we're helping Mr. Frederick Jones out with an upgrade on his property. This is an older property on 6A. A lot of these are a little bit challenging to get a septic system into. This particular one, and I've got some green cards here I'll give over. There is a wetland involved on this one, and that's the source of the variance request. In the middle of this was an old farm pond or that sort of a thing. It's an isolated vegetated wetland, so may not be regulatable under the state act, but certainly the local bylaw. And your regulations do require a 100-foot separation from both the septic tank and the leaching field. We're able to get most of that, certainly a lot better than it was, which is an old-fashioned cesspool out the back, kind of towards the wetland. So instead, we've got a nice sealed new unit. It's a 2,500-gallon tank split into a 1,500-gallon. There's an effluent filter to a watertight pump chamber. And then we're using a pressure dose pump to pump it up to the leaching field, which, as you can see, is as far as possible from that little isolated vegetated wetland. The soils in Comaquid are tough. Living there, I know these things firsthand. But in this one, we broke through to some fairly fine medium sand. There's probably another layer of clay down there somewhere because it was holding groundwater at about elevation 25, where the ground is maybe 35. But it was high enough so that we felt best to actually give it a full groundwater adjustment. Sometimes when you get these perched water tables, you don't do an adjustment on them. But here, we, in the better part of caution, we decided to do the full adjustment. We're still able to get that system below grade, which is always key. So we put a liner on the low side. There's a strip out, kind of the fill in the B layer. And then you'll have a full 4 feet of nice dry sand down to the adjusted groundwater, which is then 3.8 feet above where we found the groundwater. I don't personally think it would ever get that high, but in an abundance of caution, we did the full adjustment per code. And the soils had a little bit of fineness in them, so sometimes you go 5 foot to adjusted groundwater. Here, there was passing the 200 enough to push it down into the less than 5-minute range where you need 4 foot to groundwater. And again, it's super conservative because we used a full adjustment on what I'll guarantee you is a perched water table that's about 10 feet below grade. So I think you can see we've done the best we can with it. Again, it's an old house. The plumbing comes out the back, so our hands are kind of tied there. Did the best we can, keeping the tank as far from the wetland as we can. But again, that's a sealed unit, and then the pressure line pushes the effluent to a full 80 feet off of the perched wetland. And I think it'll be nice and safe for the environment. We've submitted the floor plans, existing 3-bedroom, proposed 3-bedroom, so there's no increase in flow. And under maximum feasible compliance and your regulations, when we're doing the best we can, you'll generally approve these variances, so we would appreciate your approval. And again, that pressure dosing does spread the effluent out over the aquifer and prevents any ponding, and sometimes you can get some channelization with a gravity system where you might get a wetting front that gets down and brings pathogens to the aquifer. Here, it's spread out more, so there's less of that. The DEP advocates for the pressure dosed, and so we did provide that. For those various reasons, we sure would appreciate the approval of these somewhat modest variances, and I'd be glad to answer any questions that you have. Thank you.
Thank you, Dan. Any public comment on this one? Staff?
Staff has no objections.
Any question from the board member?
Well, I mean, usually we require 5 feet separation. How does that affect this pond?
So, with your permission, so the material that we found there was a fine sand. When you do the perk test or the sieve test, and it's less than 2 minutes to the inch, it's 5. You're right, there's a 5-foot separation, but when you get the finer material, Title V, as of right, grants you the ability to go to 4 foot to adjusted groundwater. And so that's what we did in this case. It fully meets Title V without variance because it's got some fines in it. And I guess the thought is that, the effluent doesn't go as fast, it hangs up, and so you get more removal of pathogens, and you don't need the full 5 feet. And again, I'd remind the board that we're going with almost a 4-foot adjustment. And if you look at the back of Title V, when you look at the USGS Frimpter method, rather, It says in perched groundwater conditions, you don't do adjustments, but here in abundance of caution, we put a full 4-foot adjustment on it. Models were hard to see because it was deep, and we didn't, so it's, I think, by any measure, a very conservative design.
You're saying because of slower percolation rate?
Yeah.
What was the percolation rate?
Less than 5. It was a sieve analysis, and the amounts passing the 200 would put us into the range of a 4-foot separation.
Yeah.
So less than 5
So it meets
minutes to
Title
the inch.
V, Dr. Caniff?
You all right with that?
Yes.
Yeah.
All right, good.
Could I have a motion to approve this?
Motion to approve.
All in favor? Aye.
Aye.
Thank you.
Thank you for your time.
I still have a long list to go, so if you can minimize the comment on your application and so forth, I appreciate it, because I still have another meeting to go. The second one is Matthew Eddy, Baxter 9 Engineering and Surveying, representing owners 231 Fifth Avenue, LLC, 231 Fifth Avenue, Hyannis map parcel 245-040. Variances requesting from the State Environmental Code Title V and from Town of Barnstable Code 360-1, requesting reduction in SAS separations to groundwater from 5 feet to 4 feet, reductions in SAS setbacks to the property line from 10 feet to 1.5 feet, reductions in cover from over the SAS from 9 inches to 6 inches, and reductions in SAS setback distance to salt marsh from 100 to 88 feet. Matt.
Good afternoon, everyone. For the record, Matthew Eddy, professional engineer with Baxter 9 Engineering and Surveying, representing the homeowners, Mark and Barbara Clayman. If I could, just real quick, Tom has asked me to, there's a minor revision. There was no design revisions, but it's just we added the soil logs from the perk tests that were done. Then there was a sieve analysis done also, so that was added to sheet 3.0. So Tom's asked me just to bring a copy of that
Yes,
sheet
please.
for the board.
Yeah, that's fine. These are minor
This
revisions.
is a change this afternoon, so you don't have that.
What's
update.
that?
This is a change this afternoon for the update.
Thank you.
Thanks, Matthew. All right.
Yeah, thank you.
So not too dissimilar to the one that just preceded this. This is a existing house at 231 Fifth Ave in West Hyannisport. Smaller lot, upland of about 9,300 square feet. There's an existing 3-bedroom home on the lot with a garage, attached garage. It has a older septic system, not a Title V design. As you can see on the existing conditions plan, the existing septic system is located on the front of the lot, up near the front property line, which is basically the road right-of-way property line. The house is on public water. The lot contains, we have salt marsh to the west, and there is also a coastal bank, which is actually not on our lot. The toe of the coastal bank starts on our lot, again, kind of to the west, very shallow. It's only about 4 or 5 foot high coastal bank, and the top of the coastal bank is actually further from our site and off-site, and I'll explain that in a moment as to why I'm explaining that as far as distances. So with that, the proposal is to raise and rebuild the house, reconstruct with a 3-bedroom home. It's generally in the same footprint, so this is considered an upgrade. There's no increase in design flow, septic design flow. We have kept the SAS and the septic system, the disposal field, as far from the wetlands as possible. Again, it's up by the front property line. It's in the same location as the existing septic system. So that's there was the setback from the property line of 1.5 feet, where 10 feet is required. So that's one of the variances requested. Again, that's the same location. The existing is 1.5 feet. And just to note, that is the road property line. It's not the side property line, so we're meeting the 10 feet on the side property lines to abutters. We also have setback variance requests under the Barnstable Code for the 100-foot setback to wetlands. and that was why I was kind of describing the coastal bank. So real quick, to the salt marsh, the existing septic system is approximately 89 feet. We're proposed at 88 feet, just because now, per current Title V, the disposal field is larger. So that's the reason that it's slightly closer. Again, we've kept everything as far away as we could. And then the coastal bank, on the plan, I defined the distance to the toe of the bank. Normally, it would be to the top of the bank, but if you look at the configuration of that coastal bank on our lot, the top of the bank really has, the coastal bank really almost has no, application to this lot, but we have to identify what that is to the coastal bank. So to the toe of it, we have approximately 88 feet existing, and the proposed will be 86 and a half feet, so slightly better. I did just from the top of the bank, just so you have that. The existing is about 97 feet, almost 100 feet from the top of the bank. We're proposed at 96 feet, so again, generally the same. The septic tank from the toe existing was 80 feet. We're proposed at 76 feet. And then from the top of the bank for the septic tank, existing was 92 feet. We're at about 87 feet. All of those setbacks meet and exceed the Title V requirements. It's just the local code aspect. And then we have a request under the upgrade variance for separation of groundwater from 5 feet to 4 feet. Again, Title V, when you look at maximum feasible compliance, identifies different hierarchy, if you will, of variances. With the perk rate that we have, again, it was done as a sieve, so we used the less than 2 minute inch perk, which would require 5-foot separation under Title V. We're requesting 4 feet, which is an allowed variance under Title V under the maximum feasible compliance for a local variance upgrade. And then finally, the reduction in cover over the SAS. Title V looks for 9 inches. We're requesting 6 inches, just to try to, it's a slightly mounded system. We're trying to just keep it, a little bit lower from the mounding aspect, but for an aesthetic aspect, as you can understand in the West Hyannisport area with the houses that are there. So. And then finally, separation to the water line. The water line out in the road is about, this is an approximate because it's buried based on records as built where it's located. It's about 8 feet from the existing septic system, and we're keeping it at 8 feet from the proposed septic system. So no change to the separation to the water line. And with that, I would be happy to answer any questions. Thank you.
Any public comment on this? None, staff?
Other than the separation to the vertical distance above the groundwater, only 4 feet instead of 5 feet, we would have no objections. This board has not granted that variance for many years. As you know, when John Norman was chairman, 5 feet is the goal, not 4 feet.
The reason this is different from the previous one, Dan was using a seasonal adjustment level for
Correct.
the groundwater separations.
Yep.
So at worst case, that would be happen, but most of the time it would be less. It would be more than 4 feet. But in this case, you have 4 feet to the groundwater. There is no adjustment.
Correct.
So that would be the concern in here. Like Tom said, in the past, we have been trying to stick with the 5 feet as possible. So one thing that I'm looking at is like, can you increase the depths to the groundwater?
I mean, the only way, we could raise the system further. It just, it turns into a little bit of an aesthetic aspect.
How high, there's a little wall on.
Yeah, so it's, it
house.
would have to raise it, I'd raise it another foot. I mean, we're at 4 feet, I'd raise it another foot. So you'd end up with that kind of front wall section. We've tiered it, if you will, if you saw on the plan, again, aesthetically trying to accomplish that. So you'd end up with, it would be almost 2 feet at the front property line that you would have basically a wall. I was trying to keep it a little bit lower at the 4-foot separation, which again, Title V does allow, understanding what Tom just said. Both Tom and Mr. Lee said regarding the 4-foot versus 5-foot. But what was the point I was just going to make? I just lost the point I was going to make. But I was trying to keep the elevation, the ground elevation over the disposal field, which is right at the front property line, so that the height of it, that smaller wall, I'm almost calling it like a curb. It looks almost like a step or a curb as opposed to a wall. And I know you've probably seen some throughout town where you get the mounted systems and they start to look, not great. And I know there's been complaints on some of them before. I remember there was one right off of Craigville Beach Road going towards Hyannisport, and it actually got removed because of, I think, a lot of complaints. This was several years ago, but that's the reasoning. If the board feels that we should, again, I could raise the grade over the SAS and achieve the 5 feet. It's just, it's a tight little lot. The driveway's right there where there's elevations that we can't modify between the road and the driveway has to tie into the existing road elevation, so you start to get constrained.
We don't have at least to me, I don't have a concern in other setback reductions requirement stuff.
Yep.
I'm more paying attention to the depths.
Groundwater. Yep. I mean, of note, just to point out, I mean, it's obviously a significant improvement over the existing system. Again, without excavating it, I don't know for sure, but I'd estimate that the existing system is probably about 2 to 3 feet of separation to the groundwater.
Right. But right now you're doing
So it's
this upgrade.
So it's
you might
it's an
as
upgrade.
well
So it's an improvement, and again, in conformance with Title V, what Title V allows. But again, I defer to the board if that's what you want to see. We will make that adjustment.
Do you want some time to see if you can go back and look at the site and see if you can do it in a way that's aesthetically pleasing?
I mean, with what we can do, I can still accomplish it, and there's no flex on the site. I mean, where this system is going, the house, the setbacks, zoning, I mean, all the different aspects, and the physical parameters of the lot. There's just nothing else we can do. I've made the disposal field, the SAS, as shallow as I could to get, maximize that groundwater separation. So the only thing, I looked at it a lot, and I played with a lot of kind of different scenarios to see what made sense. And the only thing that we could do to get, if the 4 feet isn't acceptable, is to just raise the SAS. I'll just take the whole design, and it's just going to come up a foot. And so that ground elevation over top will raise by a foot, and then that kind of second wall, that lower wall, if you will, is just going to have to raise. It'll raise along the driveway and then along that front property line.
How wide is the system?
10 or 12 feet, I believe. Actually, it's about 9 feet.
So it's about, 20 feet from the wall to the house, it looks like about?
Yeah, it's 20 feet. It's 20 feet from the SAS to the structure, to the building. So again, maintaining, there's no variance request on that. Didn't really think it was necessary, but.
I guess I understand the concerns about the depth to the groundwater, but the system it's a huge upgrade from what was there before. And if it's going to make the property and the neighborhood, I don't know how unattractive, how unsightly it's going to be to have that field a foot higher. I just don't know if it's worth it, I mean, are all the properties in that area supposed to have mounded, elevated systems? Is that what it's all going to look like? Because I assume they all have very similar.
Yeah, it's
similar situations to deal with, right?
As you travel down Fifth Ave, closer to the water, that's where it gets more of a problem. Is when you go just a couple of lots upland, if you will, there's a fair amount of vertical rise in the topography.
So then
you don't end up seeing that.
But I think-
we're in that kind of transition area.
But I think when you drive around various places on the Cape, you do see mounded.
Oh, yeah. Yep.
That I never realized what it was, but it's now very obvious to me what that is. And it is kind of what we're supposed to be protecting here.
No, absolutely, and I've, again, looked at it, very closely and spent a fair amount of time really trying to come up with what I thought was the best approach and trying to balance everything, and obviously the safety and the health of the groundwater, et cetera. It meets,
We'll
it
bring
meets
down
Title V. I guess I didn't realize until Tom just pointed out. I didn't realize that. And I remember, Mr. Norman, who was previous chair, I didn't realize that this board was not allowing the 4 foot from 5 foot. 5 foot. So
We've tended to be fairly,
In several cases, we try to maximize as much as possible. I
Yep.
mean, sometimes we kind of negotiate, is 4.5 or 4'9" good enough for you?
right.
Well,
You know, trying to max the separations.
How about 4.5?
I think we could do 4.5 because
That there is a little bit higher than the ground.
Yeah, and I think 4.5 could be helpful too, because the groundwater elevation, that I'm using, I think is slightly conservative by, probably in the range of 3 to 5 inches maybe. So, if 4.5, that would be helpful. I mean, if that's acceptable to the board.
Okay. One last question. Tom, do we need the bedroom?
He redesigned the plan to show a 5-foot opening on the den.
Yeah, you're right. That's the intent of the architect's plan, was always that den is a den, that those openings are greater than 5 feet. They just hadn't dimensioned it on their plan, so we added the dimension. That's a greater than a 5 foot, or 5 foot or greater cased opening, yes.
Okay. So let me try this. Could I have a motions to approve this, subject to receipt of a revised plan showing a groundwater separation to the bottom of the bed to 4.5 feet?
Second. I make the motion.
Oh, you make a motion, okay.
Second?
All in favor?
Aye.
Thank
All
you.
right, thank you very much, I appreciate it. And so just for my own clarification, so I'll make the revisions and just work with staff, right? Yeah, great.
Yes.
Thank you very much, all.
You want any copies?
Sure, I can take them
I
from you. if
mean,
you
I
want.
can take care of it, too.
We can throw them away like you can.
Yeah. The next item is John O'Day Sullivan Engineering, representing owner Pamela Grinley, 64 Bayview Road, Osterville, map parcel 093-054, requesting a multiple variances from section 360-1 of the Town of Barnstable Code and from the State Environmental Code, Title V, proposed 4-bedroom dwelling, IA secondary treatments technology proposed. John?
Good afternoon, John O'Day from Sullivan Engineering Consulting. This property is located at 64 Bayview. It's about a 2-acre parcel. It's been developed with a house since the 1950s. The existing septic was most recently upgraded in the 80s. Our project is to reconstruct a dwelling, and we felt it an appropriate time to be upgrading the septic system at the same time. That existing house is 4 bedrooms, and we are staying at 4 bedrooms. The existing septic would require variances. We are surrounded to the east, south, and west by wetlands. That existing septic system would require variances today from the wetlands. The upgraded system, because of Title V sizing requirements, the leaching has gotten considerably bigger. So we do need additional relief from the wetlands, but keeping in mind, we have incorporated an Advantex innovative septic tank, which I believe, when we started this at least, was the only best available nitrogen-reducing technology with general approval from DEP. So we think that will be a vast improvement. We will also be providing 5 foot of separation to groundwater, which I'm certain the existing does not, which will also be a significant improvement. I can go through every single separation to the resources if you need, but they were sort of listed out, tank by field, by wetlands, on sheet 2 of that plan. I think unless you want me to go through every one of those, I'd be happy to answer any questions.
Staff has no objections.
Any public comment on this one? This is Orenco system, and IA approved it from the Massachusetts IA technology system. So, do you need a 4-bedroom deed restriction?
Is that one of? I can't remember. Was that a question about the office room? Is that what it was? The office room was in question?
Right.
Yes, okay, yes, 4-bedroom deed restriction.
Do you have any problem with the 4-bedroom deed restriction?
No.
If you connect to the public sewer, then
It would be
everything is
nice if we
fine.
can get it over the bridge.
Right, right, right. Could I have a motion to approve this as submitted with the 4-bedroom deed restrictions?
Motion to approve.
Second.
All in favor?
Aye.
Thank you,
You
John.
know, on these projects, John, I noticed on a couple of them, on the town website, on the description of the property and everything, where it says extra things like what the cellar is and if it's finished or unfinished, but I'm not positive on this one, this house, but do they recommend them having a standby generator? I mean, I read this, how this works, and this is complicated. You know, it must be using electricity all the time.
I assume that there will be a standby generator as part of the new house, but I did not read through it exactly to know if it's a requirement.
Yeah, it's really, really interesting.
Thank you very much,
Thank you.
everybody.
Thank you.
The next item is the Innovative Alternative Technology. Dan Nogula, representing Down Cape Engineering, representing owner, Christopher Pike, 82 Main Street, contoured map parcel 035-084, proposed IA secondary treatment technology for new construction, existing 3-bedroom property, proposed the constructions of a 1-bedroom accessory dwelling unit, no variance requested. Dan?
All right, per your directive, to keep it short and sweet, I think this is a fairly easy approval for you folks. It meets all your regulations, but the gentleman would like to tread lightly on the environment. He's adding a little 1-bedroom ADU, and so we're putting in a microfast IA system. They're a decent system. It's got the general, it was the only one with the general denitrification permit, and it's testing very close to the ones that did get the best available nitrogen-reducing technology. It's got a flow-through system, so it doesn't really need a generator. It'll work if the power's out. Nice, robust little unit, and all the regulations, testing requirements, and everything are well spelled out and well known and well adhered to. Be glad to answer any questions if you have them.
Thank you, Dan. Any public comment on this one? Staff?
Yes, Health Inspector Thomas Gagnon sent Dan Ogula an email on Wednesday, July 16th at 10 a.m. With some questions. Did you receive the email?
I was on vacation, so I did not. I
He
apologize for that.
wanted the plan to show the north arrow, an original stamp, number 3, water line for the ADU, and he asked, how is potable water getting to the ADU? And he asked about details about the 2-compartment tank. And he asked if you have come across any exemptions from that regarding the microfast 0.5, but for the 2-compartment tank.
Okay, yes. Yeah, I'll get him that information. It's my understanding that the general permit trumps that requirement. And obviously, we had reduced the, changed the scale at the request of conservation, so I guess the north arrow got cut off the sheet, so we'll absolutely make those couple of revisions and show that water line. It comes from the house to the ADU is how we'll do it, not a separate meter. So I'll make those changes, be happy to do it. And If for some reason a dual compartment tank is needed, we'll add it, but I'm 99.8% sure that the permit supersedes the requirement, similar to the size of the tank.
Yeah, I don't, did you find any information on that too?
I am not sure if you read through the latest on the ADU interpretations, they keep asking about a second tank.
Right.
Yeah, there are some exceptions to that, whereas if each one has its own tank, they don't need it. But, let's look. It would be a little bit unclear to me, but again, if you want this IA to work properly, it should recirculate to the same tank. So I think it'd be self-defeating to add another compartment, but we'll check on that, and it wouldn't be a variance. I'll just add it to the plan if we need to.
Well, because your approval, that fast system was approved way early, several years ago, before this ADU issue come up.
Yeah.
And the ADU interpretation was just like a few months ago.
Yeah.
That new interpretation. I just went through the whole thing over the weekend.
Yeah.
And every time we talk about that variant stuff, they keep asking, second tank, separate the tank.
Yeah, unless you have two separate single compartment tanks. But again, the ADUs, I mean, the IA systems, that rule has been in effect. It's anytime you accept a single family house, and these have been going for about 10 years now, and we've never done them that way. And again, local regulations are often superseded by the DEP permit. So we'll get a determination on that. It's
Yeah,
one
this
way
is
or
not
the
a
other,
local,
but-
we're not asking you to comply with a local reg here.
It's a state reg.
Just the state regs,
Yeah.
whatever it is,
Yeah.
whatever it is.
Yeah, a lot of towns have, but they'll generally follow the requirement of the permit, the DEP permit.
Do we have no, based on his responses to these concerns, we have no objections?
Do you want to approve this, waiting on for the revised plan, or he's going to check on this?
Yeah.
Either way, we'll either add a second compartment or not, but either way, we'll get an answer and submit a revised plan, because I need to add the north arrow anyway.
Right, right.
Conditional upon revised plans meeting the state code, is that so?
Yeah, yeah.
Okay.
Okay. Any question from the board member?
No.
Could I have a motion to approve this subject to receipt of revised plans meeting the state regulation Title V?
So moved.
Second?
Roll call. All in favor?
Aye.
Excellent. Thank you
Thank
for your
you.
time.
Thanks, Dan.
We have two sewer extension connections. The first one is Martin Trawick, representing owner GLA Glasgow at 648 Craigville Beach Road, Centerville, map parcel 246-008, phase 1, SEWH 24-17, requesting second extension to connect to public sewer, requesting an additional 6 months. Are you Martin?
I am Martin.
Do you want to sit down and talk in front of the mic?
I'm a total overwhelmed redneck with all of these
Is your green
fancy
light on?
guys.
Make sure the green light is on.
I'm colorblind. So. There is a light on, but I can't tell whether it's...
Put the mic in front of you, speaking into the
okay.
mic.
That's good.
That's better.
We hear you.
Okay, I think I identified myself accurately. The original engineered preparation for the installation of the sewer at my residence and office, which is Craigville Realty at 648 Craigville Beach Road, call for the sewer pipe to run all the way around the building, because the engineer who assessed the basement and the discharge pipe thought that that was the smartest way to do it. And since I'm an English major and can hardly add 2 and 2, I still thought that didn't make sense. So I brought in another engineer who devised a plan which would allow me to spend several $1,000s in the basement reconfiguring the discharge so that I could move it to the front of the building and access it directly off Craigview Beach Road, as opposed to a half a mile of piping running all around my building. And my purpose in asking for this second extension, I didn't realize I had a first extension, but here I am asking for the second extension because I need to get this plan approved, and I need to get a plumber who actually has the ability to get a permit to do this piping reconfiguration in the basement. And then I have, and at which point I can present my plan to the installer, and instead of running it around the building, have him come straight in off Craigview Beach Road. And I'll try to answer any questions, but I filled in about everything that I know about how I'm supposed to do this.
Thank you. Sometimes it's not engineering, sometimes it's the common sense.
Well, that was my challenge to the plan.
Any public comment on this one? Staff?
Yes, staff, including our new sewer compliance manager/inspector, recommends 12 months on this one rather than 6 months, granting a 12-month extension.
You probably need it too, because, you still have to sign the contract with the contractor, and then depending on what their availability is. So I don't have a problem with that 12 months.
We're giving you extra leeway.
Okay, yeah, I was in the artillery, which means I can't hear anything. But what I can propose to the town is that during this period of the extension, I can pay the town, whatever the quote was that I owe the town for being able to access the sewer. I think it's like $7,500 or something like that.
I don't know what that is,
Yeah,
unless it's the
that's
sewer assessment fee.
The fee for going by the house.
Assessment.
Yeah.
Yeah.
I can discharge that obligation during this period. That's
Yeah. Okay.
Move to approve a 12-month extension.
Second?
All in favor?
Aye.
Thank you.
Aye.
You're all set.
yeah, great. Thank you. I'm very grateful. Cheers.
The second sewer connection extension request is from F. Michael Dwyer, representing owner Judy Dahl, 294 Phyllis Lane, Centerville, map parcel 230-133, phase 1 is the SEWH-24-325, requesting an extensions to connect to the public sewer, requesting a 12 to 18 months. Hello.
Good evening. My name's Michael Dwyer. This property's been in my family since the late 40s. My grandparents owned it when they moved down here from Situate, and their daughter bought it. Then I moved into it about 6 years ago, renovated it, and my aunt bought it from my other aunt. And she's 86 now. She's not a primary resident there. She lives in Osterville, and she's on a fixed income. So I have been slowly taking over my aunt's estate, trying to get it into pretty good financial shape, and it's going to be about another year and a half before the transfer of property will go to me. Because she's on a fixed income, the house is set back about 225 feet from the road. It's quite an expensive upgrade. I've got two estimates. I'm expecting two more, but they're in the $13,000, $14,000 range. Then, of course, there's the other issues. And right now, we're not eligible for the financing because she's not the primary residence there. I will be the primary residence. My wife and I live there. It's a very small house. It's an improvement from a cesspool, and the septic system there is about 6 years old, 5.5 years old. So it's, fairly new, and it's just my wife and myself. And like I said, when I transfer the property, I would be able to get the financing for it and take care of it at that point.
Thank you. Any public comment on this one? Staff?
Staff recommends 18-month extension for this property
Okay.
to connect to sewer.
Any question from the board?
Is the garage occupied by people?
There is a room above the garage that has a bathroom shower in it, no kitchen, and my son comes down and stays 2 or 3 days a week there. He has a residence up in Dorchester.
Dorchester.
Yeah, he works a lot down at Cape Cod
lived in
Hospital.
Dorchester.
Works with the neurosurgeons. He sells for Johnson Spinal Outfitters, so he's down 2 or 3 days a week, and he's up in Boston 3 or 4 days a week.
Okay.
Move to approve an 18-month extension.
Second.
All in favor?
Aye.
Thank
Thank you very much.
We have one temporary food event approval. Myla Preety and Jose Aquino, food certified personnel at IPR Cape Cod Church, 90 Hinckley Road, Hyannis, Mass, requesting approval for a new event entitled to IPR's Festival at the rear of the building at 73 Farmers Road, Hyannis, 6 to 8 tents. Food will be prepared on site by staff from Brazilian Grill and Marina Cafe. Welcome.
Hi, good evening.
Good evening.
So we are just looking for a permit for us to do this festival to kind of open up to the community. We just, that's going to be right behind our youth campus, which is a place that we just renovated about a year ago, that we want to also make it into like an open house where people can go in, see what we have done, and have, just a way of people in the community to get to know our church, and having, tents selling food from Brazilian Grill and Mariner's Cafe, and also maybe like a little stage where the kids from the youth campus to put on like a little show for the community, have music going on, maybe some games, things like that. So that's pretty much it.
Thank you. Any public comment on this one? Staff?
Staff has no objections to the food event. I just have a separate question. Seeing on the map how hundreds of people may be attending and crossing this busy road, are you going to have a police detail?
We plan to, yes. We look to do it for 2 days, somewhat similar to what the Greek festival they usually do. The 2-day event from 5 p.m. to around 9 p.m. and then around that time we could look into having the police detail and things like that, because the event will happen in the back of the building, so there's going to be parking in the front, and we have our other building that's right across the street, so we can have police detailing to have people cross and be especially safe, because, with kids and things like that, for sure.
So the food will be prepared on site. Does that mean it's going to be cooked there?
So for like kebabs and things like that, usually that's prepared on site, or like lemonades, things like that we're looking to do. It'll be prepared on site through Brazilian Grill.
What, are they cooking it outside?
Yes, on a grill that they have that's portable that they usually do.
Yeah, what about those unbelievable Mariner Cafe pastries? Those
Yes.
are going to be brought, right?
Yes,
Yeah.
that should be brought for sure.
Yeah, if anybody hasn't been there yet,
They're amazing.
you got to go check it out.
For sure.
It's awesome. So that's pretty awesome. You have 2 restaurants like that together.
Yeah.
Yes.
It's going to be really good food.
For sure. You guys are all welcome to come and bring your families as well.
Around the main street. It's right down here.
What's the date?
We are looking to do it on the first weekend of September, so
5 and 6.
5 and 6. September 5th and September 6th.
Okay.
And another question, I'm not sure if you need a special permit for it, if there's a chance that we can put a sign out to let the community know that those days, maybe like a week prior, those days that we'll be having the event. I'm not sure how that works, if we can get that
wouldn't
approved
be-
as well.
That wouldn't be from us.
No? Okay.
That's the building department.
The building department,
What did
okay.
you say, September 5th and 6th?
Yes.
Yeah, September 5th and 6th.
Good.
Could I have a motion to approve this?
Motion to approve.
Second. All in favor?
Aye.
Thank you.
Thank you.
Thank you. Have a good night.
We have 2 food variances. The first one is William Penisic, representing owner David Rosenberg, outdoor tiki bar, 473 Main Street, Hyannis, map parcel 308-8084. 1 limited menu, drinks and packaged snack only. Variance request to serve drinks, packaged potato chips, packaged popcorns, packaged pretzels, packaged peanuts, packaged corn chips, and packaged cedar chips without providing an in-ground grease trap. Variance requested from sections 322-3 of the Town of Barnstable Code 310 CMR 15.230. 1, and Section 901-15 of the Town of Barnstable Code. Second, variance request to utilizing an outdoor double compartment sink originally intended for hand washing and leftover drinks/ice dumping to also include food preparations for cutting fruits without providing a separate designated indoor food preparation sink as required by the 2013 Festival Food Code.
Federal. Yes.
3, variances request to utilize a separate commercial kitchens currently lot in operations unpermitted, located 135 feet away, connecting to an in-ground grease trap menu to include sandwiches, chowder, and various other items. All prepared food will be transported in containers to the tiki bar and inner bar. Overall seating would need to be reduced due to the limit of the grease trap sizing. So
I don't know if you read that as 3 options or as 3 variances, but Mr. Planchik can explain how to read these 3. Are they options or are they all 3 together?
Well, they're independent of each other. So does that answer your question, Tom?
Yes.
I'm looking at it, I'm reading it as an options.
Options, right.
Well, my question is, if we take variance number 1, do you vote on it then, and then do you go to variance number 2, and then do you go to variance number 3 and vote on it? Or how do you?
Yeah, that would make sense.
How would you do it? That's the way I kind of see it.
Or do you have a preference?
One at a time would be fine with me.
Huh? Okay.
Is that okay? My name is William Planchik. I'm representing the owner, David Rosenberg. And here we have a situation of a variance number 1, and Tom's department's been very helpful with this. Section 901 requires an establishment. Do you have the variances in writing, by the way, all 3?
Yes.
So you can
Yeah,
go
we have
along?
that.
They have the package, yes.
This is a 36-year-old lounge that has never been required to serve food due to its never having a kitchen. This building just doesn't have a kitchen, it has 2 bathrooms only. Please review the menu provided for relief of this section, which has been in full force and effect for years while it's been in business. The snack and drink menus do not contribute grease nor fat to the existing sewer. That is variance number 1. Do you have the menus submitted?
Yes, they should have this menu that's just showing drinks on one side and drinks on the second side.
And Tom's department's been working with me on this and just curtailing to make sure that there were no fats or any grease on any of the menus that you're going to be looking at. So thank you, Tom.
I just want to add that DPW did submit written comments today. They have no objection to request number 1. However, if the menu changes, that may change the DPW's opinion, of course.
Great. I didn't see that. Thank you, Tom.
So we're going to vote on number 1,
Yes.
or are you going to discuss it? Yeah, whatever.
Any discussion on question and on the first one? It's all prepackaged food.
Yeah.
You know.
You have a menu submitted in my packet,
Yep.
which you can review. It's, potato chips, popcorn, it's all packaged.
Yep.
That's,
The first one. Yeah. Anyone second? All in favor?
Aye.
Now we can go to 2. We
Okay.
approved the first one.
now, variance 2, due to the inner bar's dimension, it's not possible to install a prep sink. A hand sink has been installed at the health department's request. Please review the tiki bar plan, which is in your packet, for the suggested variance location for the dump and prep sink to service both bars. That's the inner bar and the tiki bar. The sink currently in the tiki bar is a hand and dump sink with a sideboard requested by the health department. We ask that the dump sink to serve as both dump and prep sink due to its accommodating configuration to serve both requirements. This is to cut fruit, limes, and lemons.
Staff has objections because it's not protected, it's not indoors, it doesn't meet the federal food code.
We couldn't give a variance to the federal code anyway.
No.
I wouldn't think so.
No. And then DBW has no comment on this one.
Right, because it's a health issue, not a
Correct.
sewer issue.
Correct.
Maybe as an alternative, I would suggest allowing him to, you're just cutting lemons and oranges?
That's correct.
Find some indoor sink for that purpose, not outdoor sink.
We have a 3-bay sink, as you know. We have a hand sink
Yeah.
inside the bar as well. And again,
So
to
that
the
one
health
is
department's
indoor?
direction.
It has to be designated according to the federal food code. In other words, if you're already designated as a hand sink, it cannot be also the food prep sink. It can't be both.
Right, right.
So
That's a 2-bay, right? You have a 2-bay outside in the tiki bar or 3?
A 3-bay outside, a 3-bay, a 2-bay outside, a 3-bay inside. That's for sanitation, glass sanitation. We have a hand sink. And we also have a glass washer, sanitizing glass washer that's up to spec.
Inside.
Inside, that's correct. So could one of these sinks be used as a prep sink? Because we have a glass washer. And one other item is we're all plastic because there's an outside patio, so there's no glassware. There's no glass plates or anything like that. It's all plastic.
So, not to jump ahead, but all you're doing is cutting fruit to put in drinks.
Correct.
Can't you do that if number 3 is approved? Can't you do that in the commercial kitchen and then just bring the fruit over?
If number 3 is approved. That's why I kind of wanted to do this. And the reason why there are 3, and I separated them, because if, this is a very unique piece of property. I think
Yeah,
we'd
it
all
is.
agree. It was built 40 years ago, and, it's the only one probably on the Cape. And there's a restaurant on one side, and there's a tavern on the other side. And for years, they moved the food back and forth, and it's basically a to-go. You order the food and bring it over there, and they eat it on the tavern side. So it's a unique property, and I think it has to be dealt with as such. I don't think you're going to find another property quite like this one to.
So for 2, the only thing that we can approve if you have a designated sink indoor.
In the other.
Or a variance for because I have a triple, I have a hand sink, and I have a glass washer.
Right.
I mean,
But that's designated for wash, rinse, sanitize.
That's correct.
Yeah, the federal code, you already have it designated for that. You can't use it for the food prep. But I like the idea that was presented by Dr. Guadagnoli, just use the sink in the other building that's inside, and it's already there.
That's correct, which would be variance number 3.
Right.
Which we're going to get to right now.
So on number 2,
Why don't we do number 3?
First?
okay,
Because
Okay.
then we don't have to overrule the federal code, which we probably can't overrule.
right.
Okay.
Right, right.
Sounds good. Variance number 3, now due to the unique one-of-a-kind establishment, see site plan, I included a site plan. You're all familiar. We asked that the existing 36-year-old kitchen be approved for the enclosed menu, which is this menu right here. This facility does have a grease trap, has a 1,000-gallon grease trap, and can easily handle the menu submitted. The grease trap has been pumped. I pumped it. The hood has been cleaned, and it has been inspected and certified. Prepared food will be transported in appropriate containers approximately 135 feet, just like for the last 35 years, to the inner and tiki bar.
Staff?
And one more thing, the corporation is looking for that restaurant to be open full service as a fish and chips in the spring, and I've mentioned that to Tom. So when that comes around, of course, proper measures will be taken and so forth. Right.
You were saying in 2026 you'll add another
Yes.
grease trap because of the limited number of seats?
That's correct. The corporation wants to add another 2,000-gallon grease trap to the existing 1,000 of course, when it decides to open, because there'll be
good.
friolators and so forth and so on.
Well, depending on how many seats you have.
That's correct.
In terms of the capacity and stuff like that. But
Yes, sir.
with the existing one, you are limited to 66 seats.
That's
Yeah,
correct. But
That's good.
we've already reduced the seat count down to 50. So we're not at 66, we're at 50.
Okay, okay.
And that's what we're asking for today. So,
Staff,
So
any-
DPW has no objections if you
do the
limit
last-
to 50 or to 66 seats this year. However, next year, you're going to have to increase the seats when you open the other restaurant.
and add a grease trap, that's
Then
correct.
add a grease
That's
trap.
Add
fine.
another grease trap, yes.
Yeah.
And I want to say, the food has to be properly covered during transport,
That's correct.
protected from contamination.
Correct.
So
Absolutely.
what do you push it on carts with dome covers? Is that what you?
Well, I think, we only have 50 seats, so I think that the staff will be able to, just carry the boxes out, and so forth.
What food is going to be cooked?
Right on the menu that you see, really not all that much.
No, I didn't
The
think so.
chowder will be heated and so forth, so there's really not a lot of, there's no fried food whatsoever, as you
Yeah.
can see. I would imagine with the passing of the variance number 3, that we could expand into a heavier menu. Wouldn't you agree, Tom? With your authorization?
Possibly.
Yeah.
Just so you know, this is not marked correctly. The menu should be marked number 3. It's marked number 2.
Oh, okay, I wondered about that.
Right.
All right.
Correct, Bill? Yeah.
Is that, yes, you're right.
Yeah.
Sorry.
Okay, so
Move to approve.
second.
All in favor of number
Aye.
3? Aye. Do we need to vote on 2?
I'm sorry?
I don't
Do
think.
we need to vote on 2?
No, I don't think we need to
Oh,
vote on it.
Okay,
Yeah.
okay.
Yeah, I'd like to see it withdrawn. Would you withdraw number 2?
I'm sorry?
Will you
Draw
withdraw?
number 2.
Yes.
Number 2.
Volunteer.
Thank you.
Voluntarily withdraw.
It's nice to see the activity.
Thank you very much.
To
It's
see it being
become quite a
developed.
little oasis over there. It's been, I call it the hidden corner for so many years, when it was the elbow room, as you recall. And it's odd because when the corporation got involved, I as the operations manager myself, I'd ask people, I said, well, hey, you know where the elbow room is? We're gonna change it over. And they go, where? I go, the elbow room. How long you been here? 40 years, 40, 50 years. It was just so hidden. Now it's really become quite a spot, and some of the organizations I've been in front of just say it looks beautiful. It's become really quite a corner for Main Street, and I'm glad to hear that. Glad that my efforts are appreciated.
The
Thank
next
you.
item,
When is the band going to play outside?
The band. As soon as Tom comes over and inspects tomorrow morning at 9 o'clock, I'll be knocking on his door with my fee to get him over there. And so it's eminent, sir.
the next item on the Sandyview Historical Society has withdrawn that application.
Yes, withdrawn.
Okay. And then
Again?
we have one set of minutes, June the 17th.
Move to approve the minutes for June 17th.
Second,
Second?
all in favor? The next meeting is August the 26th. Could I have a motion to adjourn?
So moved.
Second.
All in favor? Aye. We are adjourning at 5:53.